I'm a big fan of State of Reform. I've been coming to State of Reform since it started here in Texas. And there's a lot of new solutions that are out there. We need to make sure that these new players are talking together, and State of Reform is exactly the type of place that facilitates those conversations. To bring together new innovative things in healthcare and ensure that we're working outside of our silos, and ensure that we're thinking about the member first and that we're spending in a way that the member gets better on.
This has been a fantastic experience, and we're only a few hours into the day so far. I always like to be able to get together with a group of like-minded people who are really interested in driving forward health policy for what's best for patients and what's best for Texans. And the State of Reform Conference has been the perfect place to do that.
This pandemic, I believe it's fair to call it a war. And despite all of the noise and confusion, enough of the people did enough of the right things, enough of the time, that we had a successful outcome in this. And ideally, we should be investing in ways to identify emerging pathogens and suppress them before they ever get to the pandemic level.
So I very much enjoyed being on the panel and talking to people about reforms that I think should unite us as a state, that shouldn't be, unnecessarily political. Things like protecting the doctor-patient relationship, things like reducing the price of drugs and of pharmaceuticals, expanding access to healthcare, and getting more patients healthcare in the setting that makes the most sense for them and for their family.
We have some of the most robust nursing programs in the country, but yet we still can't keep up with what the need is out there and so forth. And we've got a pretty good pipeline, but it's not adequate. What can we do to perhaps redefine how we deliver care at the bedside, in the ICUs and things like that, so that we can reduce the demand on the manpower per se?
I really enjoy it. I'm a big-time health policy nerd, so this is down my fairway, but it's always a humbling experience to be able to talk with leaders in the state and in the market. They obviously can provide just such valuable insight that I think in those leadership positions are taken for granted.
We've got to talk about things that are actionable, that are real, that are kind of pressing. These folks think these conversations are important, and so I think that's an important one to call out as a thank you.